In Spain, the number of people who have died with the coronavirus has risen again. The latest numbers from Spain show that the number of confirmed cases of the virus is up by over 7,000, bringing the total to 117,710. There's also been 932 new deaths reported, which brings the total number of people who have lost their lives to COVID-19 in Spain to nearly 11,000. Well, we can speak to our diplomatic editor, Dominic, who joins us now. And looking at that picture in Spain, obviously every day people are trying to analyse the course of the disease. What do you make of it?
Yeah, they are, Adam, and I think I have to caution people against drawing any conclusions from sort of day-by-day changes. But if you look at what's happened in Spain, the figures are, as you say, 932 deaths, taking it up to 10,935. Small mercies, obviously we're clutching at here, but that is less than yesterday, which was 950, or the day before, the last 24 hours. So that is the first fall in the numbers of people dying on a daily basis in Spain since March the 26th. The other, I think, consolation in Spain is that the number of new infections seems to be stabilising. So there were 7,000 registered new cases of COVID-19 infections, and that seems to be now plateauing in Spain. That's also happened in Italy, where the number of new infections seems to be falling off, and that's been happening for a few days now, which I think is giving encouragement to all those governments across Europe and America, of course, and elsewhere, who are saying social distancing is working. Italy's been locked down more than any, or longer than any other country, and the Italians will be saying that does seem to be working. And if you look at the number of new infections, it is falling off in Italy. That will only continue, the government, doctors, scientists are saying, if that social distancing remains in place. So 760 deaths in Italy yesterday, compared to 471 in France. So 53,000 people have died from this virus since the outbreak began, and still going up by almost 1,000 a day in Spain. So looking at these statistics, there's some encouragement that policies seem to be beginning to work, but still horrendous numbers of people dying. And a warning also, I think we have to bear in mind, from European universities. 9 leading European universities have warned that the stocks they need, the medical supplies they need for intensive care application, could run out within 2 weeks. So it's absolutely essential that these policies remain in place. Doctors and scientists are saying, to keep that level of new infection down, to get the number of people in intensive care down, and also therefore the number of people dying. The hope is will begin to fall off as well, following what we're beginning to see in some countries in terms of new infections.
Dominic, you often cover diplomacy, international contacts. I mean, what level of contact is going on constructively between national governments, or is it just a question now of every country for itself?
I think that was the case at the beginning, Adam. I think we got the case very much, the sense at the beginning very much that governments were in a state of shock, as much as populations were, really scrambling to keep up what was happening, the pace of events. And although they were staying in touch, some countries, with each other, it was very much the focus on what was happening domestically. We did see this attempt by the G20, that the rotating presidency of which is held by Saudi Arabia, the kind of virtual teleconference last week that was convened by the Saudis. That was criticised because it was seen as financially not doing enough, and it was seen as rather too many platitudes, not enough action. And I think the criticism will still be that governments are far too focused on what's happening in their own countries, where actually what is needed to deal with this is international solidarity, cooperation, to stave off the economic effects of what is happening, to help the least rich countries who are really struggling with this, even more than Western nations, but also to pool that expertise, because this is obviously a virus that's only existed and humans have only known about and been affected by for a few months. So every bit of new information, it's essential, is pooled and shared, and the effort is to try and pool to increase that enterprise to make countries share their medical information and experience. And I think people are saying still there's not enough of that and it's not helped, I think, by the fact that we have America blaming China and other nations blaming China, more of a war of words going on, rather than the kind of international solidarity and cooperation that is required to deal with this unprecedented challenge.